Hello, student. I am Professor Smita Jha, and I'm here to discuss nursing and care in Victorian wars under the banner of Victorian literature. Well, nursing as a profession was flourishing during the Victorian age due to the wars occurred during the period. Well, let us see what is there in this piece of literature. Nursing was one of the few jobs that women of the Victorian era could pursue, and this occupation is important to look at with reference to the various wars fought in and outside Europe during the period. As working class women, nurses have left little in the way of personal documents, but by combining information from various sources, the careers of some can be followed over time. It is useful to look at the range of women who provided nursing care in 19th century. Where did they fit into the system of healthcare at the time? And how do they compare with nurses working in hospitals and asylums? Significant in 19th century nursing was the role of the monthly or ladies' nurse, an individual who cared for a new mother and infant for 1 month following the birth. Midwives come into the picture because some worked as monthly nurses, and their role, particularly from mid-century, appeared inextricably linked with that of nurses. The title of sick nurse is self-explanatory, and although the term appeared only occasionally in the records, does help to differentiate 19th century nursing work. Possibly the first midwife in York was the wife of King's printer who, in 1810, placed a sign of her house, Isabella Bennet, midwife from Glasgow. Later, in the Colonial Advocate, a York paper, Bennet informed the public of a change of address. In 1829, also in the Advocate, Mrs. Sarah Tebu announced that she was an experienced midwife from England. She said that she refers to Dr. Widmer and would be setting up practice in York. Dr. Christopher Widmer, an early York physician, was a medical leader in the town, so a significant ally. Physicians were yet to stake their claim to superiority in obstetrical care and were generally accepting of reputable midwives. Widmer, as well as working with local midwives, supported midwifery training. As head of the York Medical Board, he proposed a lying-in hospital that would serve destitute immigrants and be made subservient to the instruction of students and midwives. An early York instruction of students and midwife, an early York charitable organization, the Female Society for Relief of Poor Women in Childbirth, employed the service of a midwife. It was founded in 1820 by a group of the town's more advantaged women. The society recorded in its first report that 17 women had been assisted with comfortable clothing of all kinds, a midwife and physician if required, and the best nourishment. This seems to indicate that a midwife was more likely to be present for deliveries and a doctor only in case of difficulties. For the destitute, sick, there was the General Hospital erected in 1820, but not opened for 9 years due to lack of operating funds. A dispensary under the direction of Widmer formed part of the hospital services. Female nurses would have been hired as hospital staff, but we know nothing of them at this time. If there were private nurses in the town, they remained invisible in this early era. In 1859, an article appeared in the Edinburgh Review that shook the foundations of Victorian precepts of gentle womanhood and woman's place in society. Female industry by the redoubtable Harriet Martineau did not immediately topple the edifice of middle class Victorian patriarchy and propriety, but its influence began the process of undermining the fixed assumptions about women and their role in society. In an article, Martineau asserted the unthinkable: women in the middle and upper classes of British society must have the opportunity to be employed, that is, to work outside the domestic realm and receive wages. Martineau's position was not entirely new. Indeed, Female Industry is a review article that summarizes 10 reports and books on women and work that had been published between 1843 and 1858. Female Industry was nevertheless a major catalyst to subsequent attempts in the 19th century to end the disbarment of women from full access to employment and financial independence. Nursing, by contrast with teaching, was regarded as menial, rough work. At the mid century, the iconic figure of the nurse was the disreputable and gin sodden Sairey Gamp from Charles Dickens' Martin Chuzzlewit. The physical intimacy and strenuousness of nursing duties, the need to handle bodily fluids, and the kind of knowledge of human anatomy acquired in those duties made nursing a job that was considered degrading, the lowest form of domestic service. By around mid century, however, there were several initiatives to change both nursing and cultural attitudes towards nursing. The first was the establishment of Protestant nursing sisterhoods in England in the 1840s and 1850s. The sisterhoods comprised affluent young women who paid a premium to enter and acquire nursing skills as lady probationers, and non paying working class women who were trained to carry out basic nursing care under the direction of the sisters. The sisterhoods initially provided domiciliary nursing for the poor, but some of the larger nursing sisterhood, notably St. John's House, eventually contracted to provide all nursing services in the teaching hospitals in which their members trained. These contracts were eventually terminated over financial disputes, and teaching hospitals founded their training schools later in the century. But the sisterhoods pioneered the model for systematized professional training that ultimately established nursing as an acceptable area of employment for middle class women. That the gentle sisters' work was unpaid invested it with the aura of philanthropy and respectability. Nursing's public standing was further enhanced by Florence Nightingale's mission to Scutari during the Crimean War. The nurse who traveled to the Crimea in 1854 totaled 217, nine of whom were Anglican sisters, 28 Catholic sisters, and 50 unaffiliated ladies. The 128 working class nurses outnumbered the lady nurses, but the publicity surrounded the Crimean nursing mission focused on the ladies and on their courage in facing hardships and danger in a remote foreign territory to bring comfort and care to wounded soldiers. Almost overnight, Nightingale, a lady of impeccable social credentials, replaced Sairey Camp as the popular image of the nurse. The philanthropic work of the Anglican sisters and Nightingale's highly publicized mission to Scutari raised the public profile of the lady nurse but did not promote nursing as paid employment for women. The sisterhood provided a secure and a stable home base for their members, limiting the woman's exposure to the challenges of independent living. Sisters worked and were guaranteed room and board for life, but they did not receive salaries. Not all women who received nursing instruction from the sisterhoods became members, however, and lay graduates could seek employment elsewhere. As more women were trained by the sisterhoods and in the Nightingale School of Nursing established at St. Thomas Hospital in 1860, professionalized lady nurses became available to work in hospitals throughout Britain. The women who entered the training schools as lady probationers often went on to supervisory positions in hospitals throughout the country, indeed, often founding training programs for more new nurses. These newly styled supervisors and nurses worked for pay, and while the cultural antipathy to the idea of women of the middle and upper classes working for money persisted, wage earning gentle lady nurses proliferated. While the popular perception of the contrast between the old style nurse and the new style nurse remained a contrast between Cyril and Florence Nightingale, neither of these figures was in fact an accurate representation of these nursing types. The old style nurse was usually a competent woman from the upper reaches of the working classes who had worked on a hospital ward for many years. She was one who had learned her skills on the job, often under the supervision of the physician or surgeon treating the patients on that ward. The knowledge acquired by these women was accordingly specialized. Doctors in the major hospitals favored retaining these nurses, whom they had trained and whom they knew and trusted. The new style nurse was trained by matrons and sisters. The trainee nurses rotated through the various wards in the hospital, receiving education in all areas of nursing care and medical surgical treatment. This model of training, originated by the sisterhood and followed by the Nightingale School, became the standard method for nursing education throughout the world for the next 150 years. While nursing education today is commonly carried out in universities and community colleges, the rotation of students through different areas of specialization is still norm. Within a few decades, nursing reformers had transformed nursing from a menial job into a respected profession, although there were gradations within the ranks, ranging from matrons and ward sisters to staff nurses in major teaching hospitals to private duty nurses. Nursing in provincial cottage hospitals, district nursing, and midwifery carried less prestige. The status of nursing was greatly enhanced by the establishment of the British Nursing Association in 1887, with Queen Victoria's third daughter, Princess Christian, as its first president. In 1888, the nursing record began publication, continuing as the Nursing Record and Hospital World in 1893 and the British Journal of Nursing in 1902. The December supplement to the Nursing Records first volume celebrated the transformation of the British nurse in the 50 years since the appearance of Sarah Gamp, with a reproduction of an illustration of the imaginary Sarah juxtaposed with a picture of an idealized new style nurse. This image of the new style nurse, young, attractive, and smartly attired in the dark gown and white apron and cap that had become the standard uniform. It was perhaps as imaginary as Sairi, but she nevertheless represented a perception of the nurse as well groomed and professional, or in other words, as respectable. By this time, nursing had become one of the most popular occupations for middle class ladies, and its status was underwritten by royal endorsement when the BNA received a royal charter in 1893, becoming the Royal British Nursing Association. Several prominent late Victorian women writers and activists, including George Egerton, Margaret Harkness, Mary Kingsley, and Laura Ormiston Chant, trained and worked as hospital nurses before moving on to other careers. Although Chant's family, like many others at the time, resisted their daughter's entry into the nursing profession. The 19th century is a decisive time in the development of medicine and the medical profession in Europe and North America. Not only did diseases such as cholera, typhoid, tuberculosis, yellow fever, and smallpox severely hit and decimate the population of both continents, but medical experiments and doctors also began to find effective treatments for these devastating illness. While Benjamin Russ still had to rely on the traditional and, in effect, rather debilitating measures of bloodletting during the 1793 yellow fever epidemic in Philadelphia, the late 19th century testifies to the discovery of the Aedes aegypti mosquito as the harbinger of the yellow fever virus and to subsequent measures of fighting infection. While doctors in the disease ridden Philadelphia still debated the disease's origin, be they miasmic or imported, medical practitioners in the second half of the 19th century were already aware of the salubrious effects of air ventilation and generally well implemented hygienic measure in, if possible, well organized hospital. However, despite substantial insights into medical questions, several factors prevented some people from receiving adequate care, some people from practicing medicine, and some people from living long enough to be treated. US America in the 19th century was predominantly shaped by increased immigration and migration processes that brought more and more people into the country. Some of them immediately moved westward, thus further away from the eastern cities that were at least to some extent able to provide some basic health care. On their westward journeys, people had to rely on folk knowledge of the respective cultures, on the occasional trained or untrained doctor who traveled with them, or on their own experiences with a specific illness. The cities, though equipped with several medical practitioners, including healers, quacks, as well as doctors, were at the same time the breeding ground of infectious diseases because of hierarchical class structures, poverty, unemployment, and no hygiene in tenement houses with bed sharing, as for example in New York City, as Zekhoff demonstrates in his documentation How the Other Half Lives. In addition to class, ethnicity played a crucial role in the distribution of medical treatment. Not only did slaves receive scarcely any medical treatment in the antebellum South, they also suffered as free people of color in both the South and the North from a lack of financial means to secure adequate medical help. As is well known, slavery had its own rules and considered slaves chattel and property that needed to be taken care of only as long as they fulfilled their functions for their owners. However, even after the Civil War, with the granting of full civil rights to African American men, including the right to vote, healthcare was not readily available. The medical profession itself was far from being a homogeneous entity. Homeopathy, mesmerism, and hypnotism, hydropathy, and other schools emerged and competed with the traditional medical schools, so called allopaths, for a well paying clientele. Education and admission to practice were not regulated, so that everyone who had worked as an apprentice to a medical practitioner was allowed to practice medicine, which gave, of course, rise to quackery quacks traveling with medicine shows around the country to sell their product. It was only with the foundation of the American Medical Association in 1847 that the medical profession received some structure and regulations. Subsequently, the study of medicine was more strictly organized. One group for whom these substantial changes in the medical profession at first played only a marginal role was women. Their access to medical education was barred on account of gender, with often the most ridiculous arguments of women as the weaker sex, being unable to manage the work of a physician or even a surgeon. The Victorian image of true womanhood, as explained by Barbara Welter, would furthermore put biological, social, religious obstacles in their way. Their brains would be damaged if they pursued higher education. Simultaneously, their reproductive organ would suffer and would no longer produce able and healthy leaders for the nation. Husbands and children, if they had any, would be neglected if women studied medicine or even practiced it. They would forego their natural talents given to them by God, namely marriage and motherhood, and would contribute to the decline of the nation or even to raise suicide. To use President Theodore Roosevelt, its work, moreover, it was considered to be immoral for women to attend dissections, let alone to see a naked male body, even if dead. However, some women recognized their own calling, seized opportunities, and overcame all obstacles in becoming practitioners with or without college degrees. Elizabeth Blackwell was the first American woman who studied medicine at Geneva Medical College in New York State and received her degree after 2 years, officially graduating in 1849 at the top of her class. She went to Europe to complete her education since US hospital and patients were reluctant to accept women doctors. Although European medical institutions were in most cases as reticent about admitting women, they often did offer special classes for medical students and doctors from abroad for admission fees and were not interested in gender but the economic profit these classes would yield. Many generations of North American doctors, male and female, flocked to hospitals and universities in London, Paris, Zurich, Berlin, and Vienna to enhance their knowledge of the most recent developments in medical research and treatment. When Blackwell returned, she began to practice as an independent doctor at first and contributed her share of work to war hospitals during the Civil War. She eventually founded the New York in Infirmary as both a hospital for women and children and an adjacent college for women, hired the few experienced and licensed women doctors as teachers, and sent her graduates to hospitals and schools in Boston and Philadelphia. The number of women's medical colleges steadily increased until gradually several medical college schools began to become co-educational. The need for separate educational decreased, even though many male professors still refused, or at least had problems with, teaching medicine to young women. As can easily be seen, the medical profession underwent substantial changes in the 19th century. The Civil War did not necessarily help progress in the profession, but it did create the need for a large number of medical personnel who, trained or untrained, would volunteer to work in war hospitals. During the Crimean and American Civil Wars, multiple nations commissioned female nurses to serve their troops in the belief that care work was a natural extension of women's domestic role and required the feminine virtues of kindness and sympathy. In reality, women became war nurses from a variety of motives: poverty, boredom, romance, piety, compassion, patriotism, and career aspirations. Women practiced as nurses and occasionally as doctors in the Civil War, as well as at the end of the 19th century in the Spanish American War. For the soldiers, they were often mother substitutes, angels in the battlefield, or reminded them of their beloved back at home. Documents that render those women experiences are often not only diaries and letters, travelogues, longer autobiographical accounts, but also court and army record as well as fictionalized narratives. The Union Army, in particular, was opposed to having women on site, believing that they were experienced, incompetent, disorganized. Southern tradition found the intimate physical contact of nursing to be highly inappropriate for women. It was true that most of the women probably had no prior experience with the kinds of devastating wounds and ailments the men were experiencing. But they were willing to learn and insistent on becoming part of the solution, arguing that the war was as much a woman war as it was a man's war. The women of North and South pressed on in areas that had previously been closed to Victorian women, and it is estimated that more than 21,000 women served in Union military hospitals, and a comparable number in the Confederacy, where 10% of the nursing women were African American. The Union formalized an arrangement in 1861, adopting Dorothea Dix as superintendent of female nurses of the Army. Dix was among the American women who had traveled to Britain, Turkey, and Crimea to learn from the legendary Florence Nightingale, who was already transforming nursing in Europe. It is important here to discuss the role of Florence Nightingale in the Crimean War, which helped to normalize the professions. At this time, in spite of all the prejudices and stereotypes about women nurses and doctors, the patients and the army as such could simply not afford to reject female volunteers. Florence Nightingale was convinced that every woman was a nurse because in families it was women's task to nurse children, husband, and other family members back to health. A 19th century nurse reported, when I first began my hospital training, hospital nursing was thought to be a profession which no decent woman of any rank could follow. If a servant turned nurse, it was supposed she did so because she had lost her character. We have changed all that now. By the time of the interview, nurses were held in quite high esteem, their image being very similar the present one. The Victorian nurse who witnessed these changes credited them entirely to Florence Nightingale. 2 years before Nightingale's birth, the poor reputation of nurses in the English speaking world was embodied by a minor character in Mary Shelley's novel Frankenstein. The sound disturbed an old woman who was sleeping in a chair beside me. She was hired nurse, the wife of one of the turnkeys, and her countenance expressed all those bad qualities which often characterize that class. The lines of her face were hard and rude, like that of persons accustomed to see without sympathizing in sights of misery. Her tone expressed her entire indifference. A charity hospital in New York, before the organization of a nursing school, there was described in ghastly terms. In the fever ward, the only nurse was a woman from the workhouse under a 6 month sentence for drunkenness. As a young woman, Nightingale realized the inadequacy of many women who call themselves nurses. In 1845, she wrote, I saw a poor woman die before my eyes this summer because there was no one but fools to sit up with her, who poisoned her as much as if they had given her arsenic. Her attitude against improper nursing remained constant, and in her book Notes on Nursing, Nightingale boldly declared, quote, if a patient is cold, if a patient is fever is, if a patient is faint, if he is sick after taking food, if he has a bed sore, it is generally the fault not of the disease but of the nursing. I use the word nursing for want of a better. It has been limited to signify little more than administration of medicines and the application of poultices. It ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet, unquote. Nightingale was the daughter of a wealthy esquire, yet despite nursing vulgar reputation, she felt herself drawn to caregiving. Starting in 1844, Nightingale examined conditions in both civil and military hospitals all over Europe. Paid nurses, as described above, were looked on very poorly when Nightingale was a young woman, but religious orders who provided health care were accorded respect. It was to these sisters that Nightingale looked for guidance and training. She received training in healthcare practices from Protestant deaconesses in Kaiserwerth and with the Catholic Sister of St. Vincent de Paul in Paris. Wars being about the best and worst in people, wars are life out of order, and soldiers need care if wounded or otherwise ill. One of Nightingale's first purchases in Crimea War of 200 Turkish towels. He later provided an enormous supply of clean shirts, plenty of soap, and such necessities of plates, knives, forks, cups, glasses. Nightingale believed the main problems were diet, dirt, and drains. She brought food from England, cleaned up the kitchens, and set her nurses to clean up the hospital ward. A sanitary commission sent by the British government arrived to flush out the sewers and improve ventilation. Nightingale's accomplishment during the disastrous years the British Army experienced in Crimea were largely the result of her concern with sanitation and its relation to mortality, as well as her ability to lead, to organize, and to get things done. She fought with those military officers that she considered incompetent. They, in turn, considered her unfeminine and a nuisance. She worked endlessly to care for the soldiers themselves, making her rounds during the night after the medical officers had retired. She thus gained the name of the Lady with the Lamp, and the London Times referred to her as a ministering angel. Her popularity and reputation in Britain grew enormously, and even the Queen was impressed. Nightingale's work brought the field of public health to national attention. She was one of the first in Europe to grasp the principles of the new science of statistics and to apply them to military and later civilian hospitals. In 1907, she was the first woman to be awarded the Order of Merit. Nightingale's image has often been sentimentalized as the epitome of femininity, but she is especially remarkable for her intelligence, determination, and amazing capacity for work. In 1974, the International Council of Nurses chose Nightingale Birthday as an annual day of recognition for their profession and an opportunity to distribute educational health related material. The date was aptly chosen as Nightingale, the Queen of Nurses, is arguably the most iconic figure in the nursing world. In the mid 19th century, when various careers were becoming increasingly formalized, she thus came to symbolize the professionalizing of nursing. With this, I conclude this discussion. Let us meet in the next lecture with new topic. Thank you.